Yeah, you do. We're going to follow you. Do whatever you want to do.
Yeah. Thank you all again so much for taking the time to attend this course. This is life-saving information that you can use in your everyday life, and who knows, you may have the opportunity when you may have to save somebody. A lot of you all know I had a health scare a couple of days ago. My heart went into AFib and it was scary. So I would like you all to take this serious, and I know you all will. And if you have any questions about anything, please do not hesitate to ask. We have a great speaker and teacher today. Nurse Caroline Etheridge is a cardiologist nurse at UAB. She's a registered nurse, and I don't want to say her free time, because I don't think this is what she does for fun, but she started a non-profit during the pandemic, I believe, and she goes out into the community, especially our communities, and she takes her knowledge and she puts it where the goats can get it and present the information in a way that we can use to save someone's life. What she's going to do today is demonstrate the hands-only CPR, and this is a quick way for you to get the basic principles of CPR. On that sheet that's going around, if you would like to get a certification or learn more about CPR, she'll be able to reach out to you for that. So please enjoy it. One more thing about Ms. Etheridge. I grew up in Birmingham, and I didn't know her until I reached out to her about this class. But the last name Etheridge just sounded familiar to me. Her family are really huge in the Birmingham community. Birmingham is called the city of 99 neighborhoods. I hadn't counted them all, but it's 99. But her family started I'm gonna call it a haircut dynasty. The Etheridge brothers' name was all over the city. They had barbershops in all kinds of neighborhoods. I used to get my hair cut at the Etheridge brothers. Roman got his first hair cut by one of her uncles, Willie. So I'm going to turn it over to Nurse Etheridge, and again, thank you all so much, and thank you for coming up and hanging out with us today.
Thank you.
Thank you. First, before I reintroduce myself, did everybody get a raffle ticket?
Yeah.
Everybody got one? Okay. So at the end, we'll play a little game where if I pull your raffle number, you'll come spin the wheel, and I have a couple of questions or a couple of giveaways. And it's no wrong answer. I just like to utilize this as a learning tool, as something when you leave from here, you learn something that you can just take away. So again, I'm Caroline Etheridge. I'm a native of Mobile, Alabama, and I started the Post Founders back in 2017. I used to do hands-on CPR with some organizations that I'm a part of, Birmingham Black Nurses, if you ever heard of them, as well as with my sorority. They do a lot of community service, a lot of community outreach. And with me being a cardiac nurse, but my first career is as a radiologic technologist. So doing x-rays, CAT scans, cath lab, things of that nature. So I was a x-ray tech for 10 years before I became a nurse. I've been a nurse going on 7 years. And I just bridged both of my loves together, as in focusing on cardiology. I work in imaging now, but I was able to blend it and bridge it together, done some cath lab, cardiovascular ICU, heart and lung transplant ICU, things of that nature. However, in the midst of me throughout the years doing a lot of community service, that's my passion, a lot of community outreach, I noticed that there was a loss. There was a lack of, in our communities, for our people, regarding information on cardiac. They'll talk about diabetes, they'll talk about cholesterol, they may take your blood pressure and send it to your primary care, but who looked like us was in the community going a little bit more, a little bit deeper in the midst of talk about cardiac health, CPR, and additional cardiac diseases. And with me being a cardiac nurse, that's my mission for the Post Founders, and my purpose, I believe, here on earth is to reach our people, educate our people, and come out and teach them not only about CPR, but also about cardiac health as well. And I feel confident with it, with my drastic background in it. So, what's the odds that I'm talking to someone that's about to have a TE done, or about to get a pacemaker who has AFib? He's going to get a TE to see if he doesn't have any clots or blood thinners, or about to go in for a cardiac cath, and I can talk about that because let's just call a spade a spade. There's a lack in healthcare these days as far as getting appropriate education or having someone take that time out. So we as individuals have to be a little bit more accountable. So I like to make myself available for that, and in the midst of that, with it being something that we don't hear a lot that's affecting our community, which is cardiac health. Are y'all okay with me up here with no mask on? If not, I'm
good.
Okay. So I'm gonna play a quick little video. It's like 10 to 12 minutes. It's gonna talk about the books that I gave you all, about your why. What's your why and wanna save a life, save your life, or just live, just get healthy and just live. So it's just a quick video talking about hands-only CPR. So a couple of years ago, American Heart Association did a study, and you used to hear ABCs, where now it is CAB. They noticed that there was a increase in deaths from people focusing on airway and not getting adequate airway, whereas you heard of time is tissue, like kind of what we did with strokes and things of that nature. So they changed it and they built a program called Hands-Only CPR, Family and Friends Hands-Only CPR. And this is what I offer in the community, but also, like he mentioned, I do certify in CPR, AED, first aid, bloodborne pathogens, and things of that nature. So this program is something that they implement for the community to teach people how to do adequate compressions, but most importantly, how to respond. Knowing how to respond is most important. When I've done a lot of lock-ins at the YMCA and things of that nature, I notice there's a lot of grandparents raising grandchildren these days. So them knowing how to call 911 and how to respond, because let's be honest, depending on the certain neighborhoods you're in, how long does it take for help to get there, right? I've had a friend that her grandfather passed in a household and it was her mother and grandmother living in the household, but nobody knew CPR. You know how detrimental and how they have to live with that every day? She came and got them certified. But just knowing how to respond and do compressions, get that blood flow going to the brain and to the rest of the organs, that's the most important and vital thing. And until help arrives, that's what's gonna save a life. So that's what this program is about. I'm gonna show a short 12-minute video. We have some things up here if anybody wants to come and practice. I have some flyers here as well if you want some education on just a follow-up from today. The 2 important steps is calling 911 and doing chest compressions. Also, signs and symptoms of heart attack, and most importantly, one of the biggest things that I teach in the community is the difference between cardiac arrest and heart attack. Some people think it's the same thing, and it's not. It's really, really not. So we'll talk about that a little bit after the video if you all are open and welcome to it. And also I have a flyer here because another thing people don't realize is the main gender that has a high increase of death from bystanders not giving CPR is females. Women, we die because people are uncomfortable. They don't want to get sued, or they feel like they don't want to expose. I don't know about you, but expose me. I ain't gonna sue you. Save me, okay? So that's just something that I like to leave a little nugget with people because, and I have a flyer here that's talking about a little bit more, just as in, making people aware that we women are dying out here. Our symptoms are different from men when it comes to a heart attack, but mostly in a cardiac arrest situation, people are not responding to us because they're so afraid of what the outcome is until they're not recognizing that we need help just as well as men out here. So I stand firmly on that. But I'm not going to get in my soapbox. I also have some masks here. If you all are welcome, you all are more than welcome. So there's some cloth masks here that I have to give out as well. But we can go ahead and get started with the video. Oh. Yeah, you would need that, right?
Yeah, we can. The one behind you. Yeah, that should. It says on 3. Yeah, let me go grab those out here. Let me
Okay.
grab those.
All right, little Mitch.
You need another HDMI cord?
I'm gonna put it on the, I'm gonna grab the audio video one, so this end is not supported.
It's a long one back there, that's why I asked.
I have an extra one.
Yeah, we got several actually.
Okay. Also, afterwards, I have these little mouthpieces, little key rings. They're just $3. Just if you all are interested in having a mouth guard, any event that you may have to save a life, it's a one-way valve protector here. And then also, he's gonna bring in his AED. So we'll get some education on everything
Oh,
today.
we'll take it.
If you got time, I got time too.
We'll take it.
No problem.
Okay.
Go
RCA.
back to tried and true.
Yes.
Yeah.
Throwback days.
Yeah.
That's what I grew up with. Yeah, that's it.
We should have Brother Desmond to play or something while we switching out.
There are moments in life we wish we could freeze in time. We live them. We live for them. They are intimately personal. They're glad to share. What is life if we cannot experience these moments of joy, wonder, and happiness? We want people to experience more of life's precious moments. To do that, we must be healthy in heart and mind. For the heart is where life's moments are felt most, and the mind is where these moments become memories and are relived again and again. It's why we've made better heart and brain health our mission, and together we've made an extraordinary impact. Healthier adults, more active children, stronger survivors. But we are just beginning. Until there's a world free of heart disease and stroke, we'll be there, making a healthier, longer life possible for everyone. You may ask, why do we do what we do? The answer is simple. Because we are the American Heart Association and the American Stroke Association. And life is why. On any given day, anyone can have a sudden cardiac arrest. Your neighbors, your friends, your family. By learning CPR, you can improve their chances. You can make a difference. You can help save someone's life. CPR is easy to learn, and it could help you save the life of a friend or loved one.
Think we can add a little more to that slide?
Yeah, it's a mess, but it does tell the story.
Let's remove that third bullet.
Let's try this.
Yeah, that works.
Ray? Ray, are you okay? Are you okay? Help! Help! I need help! Jess, phone 911. George, get the AED.
911, what's your emergency?
A man in our office has collapsed. I'm putting the phone on speaker mode.
He's not breathing.
What is your exact location?
2710 Wall. By the post office, the third floor conference room, we've started CPR.
Make sure you are pushing hard and fast. Count your compression out loud so I can help you with your compression rate.
5, 6.
EMS is on the way.
Okay, thanks. 9, 10,
Okay,
11,
just keep the
12,
compression
13,
going.
14,
Push
15,
hard and fast to
16,
the center of the
17,
chest,
18,
okay?
19,
You're
20,
doing great.
21, 22,
Your
23,
compression rate is
24,
good.
25,
Got the
26,
AED.
27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53,
Stay
54,
clear.
55.
Don't touch him. After the shock, I can take over compressions.
Shock needed. Charging. Stay clear of patient.
Stay clear.
Deliver shock now. Shock delivered. Begin CPR. Start compression.
1, 2, 3, 4, 5, 6, 7, 8, 9.
Sudden cardiac arrest results from an abnormal heart rhythm, causing the heart to quiver, so it can no longer pump blood to the brain, lungs, and other organs. Within seconds, the person becomes unresponsive, and within minutes, death can occur if the person does not receive immediate life-saving treatment. CPR stands for cardiopulmonary resuscitation. This course module will teach you the basics of performing CPR on an adult. You'll learn to recognize when CPR is necessary. You'll learn what steps to follow. You'll learn how to perform CPR on an adult in different situations. And you'll see why providing CPR can be the difference between life and death. By the end of this module, you'll know how to perform adult hands-only CPR, how to use an automated external defibrillator, or AED. You'll also have the opportunity to practice on a mannequin while the video guides you. For the purposes of this course, an adult is anyone who has reached or has already gone through puberty. If there's any question about whether someone has reached puberty, treat that person as an adult. Someone who is responsive is one who moves, speaks, blinks, or otherwise reacts when you tap him or ask him if he's okay. If he doesn't, he's unresponsive. When someone's heart stops beating, blood stops flowing through the person's body. Recognizing sudden cardiac arrest and the need to provide CPR quickly is important. When an emergency occurs, there's a sequence of steps you should follow to determine whether an adult needs CPR. First, make sure the scene is safe. Look for anything nearby that might hurt you. The first step in saving someone's life is to make sure everyone is safe, including you. See if the person is responsive. Tap the person firmly on the shoulder and shout directly to the person, "Are you okay? Are you okay?" If the person doesn't respond, shout out for help.
Help! Help! I need help!
Having someone to assist you can make things easier, so shout for help. Tell someone to phone 911 and tell that person to get an AED.
Jess, phone 911. George, get the AED.
If you're alone and have a cell phone, phone 911 and put it on speaker mode. If no one has come to help you and you don't have a phone nearby, leave the adult to phone 911 and get an AED if available.
Return to the adult and use the AED immediately. Check for breathing. If the person is not breathing normally or is only gasping, then he or she needs CPR. Scan the chest to see if it rises and falls. Do this for at least 5 seconds, but no more than 10 seconds.
He's not breathing.
If there is no sign of breathing or the person is only gasping, begin compressions. Now let's take a look at a demonstration of agonal gasps. Gasping may appear forceful or weak and may happen at a slow rate. Let's take a closer look at each of the steps involved in providing CPR.
Help! Help! I need help! Jess, phone 911.
911, what's your emergency?
An important step in hands-only CPR is phoning 911 to bring emergency medical help to the scene. But when should you phone them? And if you're alone, how? When you shout for help, if someone comes, get that person to phone 911 and get an AED. Make sure the person knows just what you want him or her to do. If several people are there, look directly at one of them, make eye contact, and tell the person you phone 911 and get an AED. If you're alone and have a cell phone, phone 911 and put it on speaker mode. Stay on the phone until the 911 dispatcher tells you to hang up. Answering the dispatcher's questions will not delay the arrival of help. The dispatcher may also tell you how to help the adult until someone with more advanced help arrives and takes over. If no one has come to help and you don't have a phone nearby, leave the adult to phone 911 and get an AED if available. Return to the adult and use the AED immediately. It's also important for you to know how to phone for help from your location. Do you know how to activate the emergency response number in your workplace? For example, is it necessary to dial 9 for an outside line, or is there an internal number to phone that will notify responders who are on site? Also, be aware of your surroundings. Knowing the address of your location will help emergency responders reach you more quickly, and that can greatly improve the chances of saving a life. When you push hard and fast in the center of the person's chest, you pump blood to the brain and heart. Let's look at how to give compressions hard and fast. You'll have a chance to practice in a moment. For now, just watch. First, make sure the person is lying flat on his or her back on a firm, flat surface. Next, move any clothing out of the way. Now, put the heel of one hand on the center of the chest. Place the heel of the other hand on top of the first one, like this. Push hard, straight down, at least 2 inches. And by hard, we mean hard. It's unlikely you'll hurt the person by pressing hard and fast. It's more likely that your compressions won't be hard enough. Try to keep your arms straight and your body centered directly above the person's chest. The correct rate of compressions is 100 to 120 compressions per minute. After each compression, let the person's chest come back up to its normal position. You've just learned one of the most important actions in helping someone survive sudden cardiac arrest, pushing hard and fast in the center of the chest.
All right, so pretty much that is the basics of hands-on CPR. So one of the first things is you want to make sure the scene is safe. We know if it's a gunshot, if it's a car accident, or anything like that, you want to make sure it's safe for you to come out there, right? Like, I'm all about saving a life, but I got a 4-year-old. So, and also when you approach the patient, when you approach somebody, let's be honest, we have people that's high, they're on drugs, or anything like that. They could just be laying there. You want to at least assess them to look and see, are they responsive or unresponsive? That's the key thing here. You don't do CPR on somebody that's responsive. So once you make sure the scene is safe and you approach them, you be aggressive with them. Are you okay? I would, we can give a little sternum rub or anything like that, but I don't want to get too technical. But you really want to give them a hard nudge to see if they're responsive, because they could be sleeping, could be drunk, high, any little thing, right? Or it could be where you have a diabetic fall out as well, right? They become, but you still have to make sure, are they responsive? Because if they're responsive, then they may need something to help get their sugar up in that case, but they are technically responsive. Or someone like, if your kids play sports and you have children with asthma, sometimes it could be where somebody needs respirations. They may need rescue breaths or something like that, but they may look like they're unresponsive. So you definitely want to make sure before you go pounding in someone's chest that they're unresponsive. The next thing, but the first thing is definitely, once you see that they're unresponsive, call 911. Call 911, and like I tell my students, once you begin this CPR process, you are the heart. We don't know how long it's going to take for help to get there, but you are operating as the heart. So if any event that you have to do anything, you get your phone, if you're by yourself, you put your phone on speakerphone or anything like that, because once you get started, it's you. And that's why learning how to go deep enough and give adequate compressions, you can start out strong. If you're there and it's been over 5 minutes that you're doing compressions, you're gonna get tired. But at least you know that in the beginning you started out strong. You kind of still, because if it's all about team dynamics. If you had someone there to help you, like when that guy said, hey, after we put the AED on or after we shock on this one, I'm gonna jump in. It's up to you to verbally say if somebody is around, like, hey, I need help. Caroline, when I get to this 30, I need you to jump on in because I'm tired. Know what you can do. But in the event that you're by yourself, start strong, because you're gonna be the reason why this person lives, right? Another thing I tell my students, if you walk outside the door and you physically see someone fall, you could put a time on it. You know how somebody have a seizure and they say, hey, when the last time you saw them normal? When the last time they was talking and doing normal things? You saw them fall, so you could put a time on that. You can say, okay, they fell at 1:22. I can run back in the church and get some help, right? But if you come back out, if you walk outside and you did not see that person, go ahead and start 2 minutes of compressions. Get that blood flow going to the brain, the lungs, the rest of the body. Then go and get help, because at least you got some blood flow going. You ever see people that have a stroke and their residual are different compared to others? It's because they were able to get help quicker than someone else. And so therefore your residual or things may be a little bit different compared to somebody else with a stroke. So once you get that blood flow going, their residual could be different than someone who's laying there for 10, 15, 20, 30 minutes and nobody did nothing. Guess what their residual gonna be? Death. It's gonna be death. Another key thing, I'm trying to think of some things before I get started with the whole practicing. So if you find yourself when you're giving compressions, and like they said, you are, like I said, you're operating as the heart. So in the event that you feel yourself getting tired, when you go down, you want to make sure that that chest comes back up, right? Because another thing, the heart pumps systolically, diastolically, right? So when you allow it to fill back up, it's filling up with blood, and then when you go back down, you're pushing the blood out to the heart, to the brains, to the rest of the organs. But if you're just down and you're not really giving adequate compressions, the blood is just pooling. And I'm gonna give y'all another little nugget because I'm just a little cardiac geek. The blood, if they have a clotting disorder, anything, blood just pooling there, it's gonna cause a clot. So the next time you come back with a really good chest compression, you done possibly threw a clot somewhere, but that's on a whole nother subject. But that's why people with AFib or things like that has irregularities with their heart muscle or heart pumping are on blood thinners, because it's easy for them to build up clots. But that's neither here nor there. I just threw that out there when you all begin. So first step is make sure the scene is safe. Call 911 and go ahead and start your compressions. And you're gonna go hard and fast. Like if we was doing actual certifications, it's a certain ratio in between. But when you're by yourself doing hands-on CPR, you just focusing adequate compressions and allowing the chest to rise and fall. And you're gonna go in the center of the chest. Do not be afraid that you're going too deep. You're gonna break some ribs. That's expected. You have to. The heart is up under the rib cage, so that's expected for you. Any questions before I move on? Before we get to practice in or anything? Okay.
But if you are on blood thinners like that, how would the person, they wouldn't know that?
No, you wouldn't know. That's why I said it was just an extra little, extra little nugget to know.
Because I'm on blood thinner, so I just thought I'd ask.
Yeah, if people have AFib and their heart is irregular, then sometimes they'll be placed on blood. If you have a risk of clot or DVTs, you're going to be placed on blood thinners and stuff like that. I was just giving an example as in when we don't give adequate compressions, where the heart, the blood is pumping out and you're going down and allowing it to fill back up and going down again. If you're not doing adequate compressions and that blood is just pooling up there, it can actually pool up. You know, like if we're bleeding, how it clots, it will clot there, and it's a possibility that you can do another compression and throw a clot and push your clot out to the brain or the other organ. Yes, sir.
You know, they used to tell us in safety classes that you also check to see if the person had a pulse. You know?
Yes, sir.
I noticed they didn't say that on this.
What? Because technically in the community we're focusing on adequate compressions. But yes, if you got certified or technically in a certification course, you'll learn how to check the pulse. You'll go more in depth with the AED, airway, things of that nature. But in the community, if you know nothing else, if you had no safety course, if you're not a healthcare worker, anything like that, you will increase in saving a life by 10% just by giving compressions until help arrives. Right. But yes, you'll check a pulse to see if they have a pulse, but also that's the whole part of checking to see if they're responsive too. Because if you check a pulse and they don't have a pulse, and they're pretty much not responsive, so you definitely want to go ahead. But yes, that does go a little bit more in depth if someone wants to be certified. Hint, hint. We'll definitely go into all of that. We're actually going to do something with his AED as well. So AED also helps. It helps aid in cardiac arrest. Because like I said, a lot of people think that cardiac arrest and heart attacks are the same thing. Did you all think that as well? It's not. So in the cath lab, this is what we call it. So if you ever heard of EP, electrical physiology, that's cardiology. My area in the cath lab, we're heart attacks. We say they're the electrical with the plumbers. Heart attacks comes from clogged arteries, arteriosclerosis, if you're diabetic, things of that nature. You can live and be moving on for weeks at a time having a heart attack, actually in the process of having a heart attack. And I have a flyer up here that talks about signs and symptoms. And in women, you know, we're different. We may experience nausea, vomiting, some jaw pain, or left shoulder pain for us. But that's when, if your doctor say, hey, let's do a diagnostic heart cath, or something like that, they're making sure that you don't have any clogged arteries. That's a heart attack. Now, can it lead to cardiac arrest? It can. But a heart attack is something that we can go on out every day until you have a symptoms of pain, but you don't know how long that blockage has been building up, right? Cardiac arrest, you're gonna drop dead. It's the electricity of the heart. It's what this AED aids when it shocks you back into regular rhythm. Like I said, some people who get defibrillators, pacemakers, they have electrical problems. The heart is not pumping. It's not sending that electrical activity. Without electrical activity, you have nothing. So people who have SVTs and AFib, things like that, heart rate just all over the place. They'll get you on medication to help control that because it can lead to a cardiac arrest. So cardiac arrest is all about the electricity of the heart. And when this electricity stops, you stop. So that's an immediate. Whereas heart attack, it's more clogged arteries. You can get a heart cath and they say, well, your LAD is 50% clogged, or this, they may put you on aspirin, baby aspirin, Plavix. That's like some of the cardiologists' little cocktail. But you continue on another day. Or you hear people that get stents. They get stents to open up those arteries and things of that nature. Heart attack, cardiac arrest, no. They're going to drop like a fly. So that's the big difference. But people think they're the same thing and they're not. So that's one of my biggest things that I push in the community is definitely the difference between cardiac arrest and heart attack, because a lot of people feel like it's the same thing and it's really not. And it's all about verbiage, what you're comfortable using, what someone is comfortable saying to you. But it's definitely a difference between the two. Any questions before I move on? Okay. So the AED adds is in addition to if you get certified, or like you go to the airport, or you at school, or you at your job and they have an AED, I suggest everybody know how to work one, because or they have them at churches, or things like that.
Yeah, that's all.
Oh, from church. I thought this was one you brought in your car.
No, it's in the office at church.
Oh, okay. It helps. It helps not in a heart attack. Cardiac arrest. This is the electricity. This is it right here. This is what's gonna shock them into regular rhythm. It's gonna talk to you. You put this and your compressions together, we got a winner. We don't even need help. No, I'm just joking. We don't need help, but these two definitely go together. So, what can I open? Okay. So, with the AED, when you find somebody that's unresponsive, they fall out in church, you tell someone, call 911, somebody gets the AED and they come. Every AED operates differently. Some of them, once you open it, it automatically comes on and talks to you. Some of them you have to plug in, but most importantly, turn it on. Some of them automatically come on, like I said, but it does. At work, ours automatically, no, we have to turn it on, because we're always like, adrenaline's going, we put the pass on, we're like, why they ain't talking? And it's like, turn it on. We forget. I'm not going to use the pass or anything, but I just want to show you all how it works. So with this one, and also like they said, sometimes you'll have AEDs that have...
Stay calm. Follow these voice instructions. Make sure 911 is called now. Begin by exposing...
Okay.
It's police proof. It'll tell you what.
It will. Okay, so this one is good. Once you open it, it tells you what to do. So some of the pads that you'll find in some AEDs, majority of them fit adults. So some of them may have some for children or for infants, but if you don't know if you don't know the age of a child, use an adult. The expectation is to use the adult pads regardless. Let the machine utilize its resources. It's going to monitor, it's going to sense the rhythm that adult child or infant is at, and it's going to give them the right rate. You don't have to make any adjustments like the ones we have to do at work. So your pads are in here, you'll open them and you'll put them on. I didn't bring my AD, but you'll put them right here on the right side. Now if someone has, 9 times out of 10, 99% of the time, if someone has a defibrillator or pacemaker, it's going to be up or on the left. Unless we go in and they have 2, or if we go in and they have scar tissue, we have to go to the right side. Typically, it's going to be on the left. So your pad is going to go right here, and the other one is going to go across beneath. Me personally, everybody's body habit is different. You have people with extra rolls, bigger breasts. I don't have time to fool with that. I just put it down the side here, because the heart lies on the left, and when it's shocked, it's going to come in and shock and give the electricity that way. Oh, I still don't want to open them though.
Oh, yeah.
I don't want to waste no pads. You may need them. But in the event of this one, oh, y'all got a lot of little pads.
Yeah,
replacement pads. Okay. It has a picture on here as well. So in any event that you're the person that has to get the AED, you see it right here. Yes. But the one that goes right here beneath, you can also lay it on the side here as well. And to me, I like that. That's more, when somebody's coming in, I get called in the middle of the night, somebody having a heart attack. When I put the pads on, like I said, I don't have time to be fumbling with extra skin. I'm ready to put these pads on, and I'm the one that's always want to do compression. So I'm going to be I don't have time for the IV, get medicine. I'm ready to do compression. So, but this is how an AED adds in addition to doing the compressions. Once this is on, the machine, like you see, once it's going to tell you where to place it and what to do. It's going to, if it says stop, all clear, it's picking up the rhythm. and then it may say it can't find a rhythm, you'll continue CPR. But if it says shock indicated, press the button, then whoever has the AD, you'll make sure nobody's touching the person, nobody's touching the table or anything around it, because you don't want anybody to get shocked or anything like that, right? It'll shock them. If the rhythm is still kind of funky, out of whack, it's going to tell you to continue CPR, and that's going to be your routine. You're going to do compressions, and when this analyzes the rhythm and it's ready to shock, it does it every 2 minutes. So imagine that, you're doing compressions for 2 minutes, then this come along and analyze it. And if they don't have a rhythm to shock, you're going to keep on doing compression. So that's why I said, if any event that you have a team here, team dynamics is let that person know what your capabilities are. If you know you got a sore shoulder, you know you had open heart surgery, you know you having chest pain, don't get no compressions. If somebody come to help you, tell them you need to swap out, because you're not going to be giving adequate compressions to the patient. So really, who life are you saving? You're not, yeah, you're doing something in the event, but when help arrives, that's for you to speak up and say, I need you to swap out with me. Know what you can do, right? Because there could be other things that you can do, but it's no reason to stand here and act like you're giving compressions when you're really not doing it adequately, okay?
I have a question. So, if in the event, like in that video, person passes out, you begin compressions, and while you're giving compressions, person number 2, if there's a second person comes in with AD, and then they apply the patches while you're continuously.
Yes, ma'am.
Like, you don't break it off.
You do not stop. If you have to stop for anything, like if we get to a course where I'm teaching you airway, and you do compressions and airway, any event that you have to stop, you want to make it less than 2 to 5. Like if you're swapping out or something like that, you make it less than 10 seconds. Okay. But because once you get that blood flow going, it's going to be hard to get it back up. Okay. So that's why I said, if you found somebody that's unresponsive and you didn't see them fall, go ahead and do 2 minutes of compressions, then leave, at least get it going. But yes, whoever comes with these pads, they're going to work around you.
I got you. Okay.
Yep, they work around you. Yes, ma'am.
Okay. Person with the defibrillator. We can go back over that again as far as where to put the.
So on this one, if you got a defibrillator, it's majority of the time going to be on the left. Right. So this pad is going to go across here or on the side, so it's not going to bother it. Okay. But in the event somebody has one over here, you don't place the pad. Okay, yeah, you don't place the pad. You can place it on their back, on their shoulder blade. Another little nugget. If you come to the doctor and you're finna get cardioverted, some people get shot back to the rhythm, your doctor say, hey, I want you to come and get a cardioversion. Your first thing is you're going to get a TEE, which is a transesophageal echocardiogram. They put a tube down your throat to check and see if you have any clots. Because once again, you don't want to shock somebody or do compressions and they have clots, and you'll you'll send a clot, right? With the pads, don't be surprised or alarmed. The pads are going to be anterior and posterior. They're going to be in the front and they're going to be in the back. Because that's a particular way how they shock their right atrium to get you back into rhythm. Because a lot of times it's like an atrial type of versus a ventricular rhythm. But that's a little extra. But I want y'all, if y'all go to the doctor and you have to get it done, don't be surprised that they don't put your pads up here and up here. Any other questions? Okay.
AED machine, do it have to be serviced every so often?
I believe they do, don't is it annually?
Yeah, you can check it. We've always just checked it annually, and we replace the battery every 5 years.
And it has an expiration date on the pad.
But the good thing is, most of them, 90% of them, even if it's like 1% battery, it still should be enough to shock it one more time. They made them fail-proof in a sense, and it even comes with a little kit in case someone was hairier or they had some type of clothes that was obstructing. You can cut them off and give them a quick shave just to make sure it sticks.
I was just gonna say this is cute. Y'all got a shave in here. Y'all step it up. A lot of AEDs you'll see don't have this, but if in the event that somebody is hairy and the pads won't stick, you can shave them real quick. Or any event somebody is wet, you want to pull them out of the water, put them on something dry them off, because what's the point of shocking them when they're wet? You can cause a whole nother situation.
And the particular kit we have here at church has scissors in there so you can cut clothes off. It has a CPR mask and gloves.
Look at y'all. Come on now. I like it. I love it. I love it. Y'all, baby.
Yes.
Y'all got the business, okay? I love it.
Hopefully we never have to use it.
Look, that's what I get. I get a lot of pharmacists, you know, when they just doing like the vaccinations and stuff, and they have to be BLS certified. They say, we hope we never have to do this, but they have to be certified in the event somebody have a reaction to vaccines and stuff like that.
Believe me, it'll happen.
Yes. Any other questions?
So you're saying, you know, for about 2 minutes and then switch to the pads and switch back?
No, so you're only gonna do the pass in the event somebody brings that to you.
Okay.
So person number 2. Person number 1 remains doing the compressions until the person put the pads on, and then in that event, y'all can go ahead and swap out. But you're gonna remain doing the compressions and let that talk to you and tell you what to do.
Okay.
Any other questions? All right, so we can get to the raffle. Did y'all need me to show y'all anybody? Well, I guess in the end we can kind of practice if you want to. So with the raffle, I do this with large number crowds, and I have some little giveaways down here. So you would come and spin, or I can spin it for you, whichever you want me to do. If you don't feel like getting up, and I have questions, or you just get a free pass regardless. All right, and just tell me if you want me to spin it for you or not. All right, ticket number 791728. Okay, you want me to spin it or you want to come spin it? Y'all come on down. You want me to spin it? Okay. Oh, she get a freebie. Yeah, so the giveaways are, I have hand sanitizers, I have one phone holder, I have magnets, car coasters, and badge reels. Which one you want? Okay, here you go. Thank you. And I'll leave the flyers just whenever you all want to. And like I said, in the books you all have, I like to offer those, or I like when people, you know, purchase them for their organization or things like that, because it covers adult, child, and infant CPR and choking. So that's a little takeaway that you'll always have. I like to leave reference tools so you'll be able to always have something, or a guide or something to go back to. Because everybody don't want to be certified, but at least this will give you something to learn and know how to respond, but also you have your book there to cover the child and infant. All right, 791738. It's you? You want me to spin it for you?
Yeah, you can spin it.
Okay. A question. Let's see how I'm feeling. Okay. Okay, let me go. All right, let me go back in my stash and look again. All right. Okay. What gender is less likely to receive CPR from bystanders?
Less likely to women.
Yes, ma'am. Come and get
I am a retired cardiac nurse.
Oh,
That's too funny.
she know all about what I'm talking about. Hey, well, at least she can clarify that I know what I'm talking about. How about that?
I told my husband we're going to let her teach her class.
Oh, yeah. Look, y'all making me feel real good. I'm about to apply for NP school at South. And I want to be a cardiac NP. That was my reason for transitioning from radiology to nursing. All right, y'all ready? All right. That is, baby. That's confirmation, my calling. 791729.
That's me.
My little lady, she been nodding at me. She been my cheerleader the whole time. You want me to spin for you, or you want? Okay, TJ, you want to spin? Okay, he want to actually. He doesn't do well with large crowds, so we'll get there. You get a gift here. What would you like? I can send it down.
Ask her a question. Ask my sister a question.
I will. I'm gonna get her too.
Just send me something. It's fine.
What would you like? I have hand sanitizer, a car coaster, magnet, or badge reel. Okay. Little side note real quick. Do you all use car coasters? Yes. Let me tell y'all. I didn't. I just be hood. I just use a napkin. So when I got this girl to make me some promotional items, and she said, I said, what is that? And I was like, oh, that's cute. Okay. And I can remove my napkin. Yes. Okay. 791-745. Okay, what you got? You ready?
Yes.
Don't worry, we're going to keep going to all these. We're going to 7 questions. Okay. You want to pull? Okay, pull.
Do it.
You want to say the number? Okay, go. Y'all say it out loud. No, you don't say it out loud. Let me see. 791-744. Right here. Okay. You want me to spin for you? Okay. I'm gonna spin it again because it jumped.
You got a question.
Okay. It went on. Okay, it went on free. But I'll say that for somebody else.
You would have answered it, man.
I'm gonna still do it.
Okay.
I just let it go. I want my free.
What did I put? Okay, here they go. How does an AED assist in CPR?
It shocks you and brings you back, your heart rhythm back.
Good job. It increases the chances of survival by shocking the heart, bringing it back to normal rhythm, and it helps the heart start back working properly. So great job. What would you like?
You know, real.
The badge Rio.
Yeah.
Thank you. You are so welcome. All right, you want to pull out a little PJ? You're slipping on the clock. All right. 791-743.
Man.
Right here. Oh, you? Okay. You want me to spin for you or you want to? Okay. Question. What does AED stand for? Okay, I can make it a true or false.
Electronic.
Anybody want to help her out?
Electrical.
Anybody want to help her out? She's still gonna get something. What does AED stand for, TJ?
Audio defibrillator.
Automatic.
Perfect. Automatic external defibrillator. What y'all want?
Oh, it don't matter.
Come on.
Sanitizer car. I don't want no sanitizer. I got plenty of that. Just give me something that's not sanitizer.
Want a magnet? Want a magnet?
Okay.
What would you like?
Car.
I have blue, black, and gray. Does it matter?
Nag.
She said black.
She said it didn't matter.
It didn't matter.
Oh, okay.
Go pick them up, baby.
Thank you.
All right. We're gonna keep going till we go through all the questions. 791-670.
I'm being nosy. What it look like. Trying to see what it look like.
70.
670. All right. Going to stand for you. Okay. What position do you place the person in before performing CPR? What position do you place the person in before starting CPR?
Solid.
I can't hear you.
Solid.
Great job. See, these questions ain't hard. Wait. Somebody say Sonic. You like Sonic. What you like? All right. 791665.
Hard question.
They all easy.
Y'all about to get y'all
Adequate compressions help increase blood flow to the heart, brain, and vital organs. True or false? True. What would you like? Come on, gray. Gray, blue, or black?
You got red, she'll want that.
I don't.
All right.
Is that the blue one? Did I give you a blue one in your hand? I think so.
I'll deliver to my wife.
All right. 791739.
Oh, I didn't give those two out. 39 and 40.
Okay.
Nobody got those yet.
Okay.
Sorry.
736. All right, you want to stand for it? When performing CPR, you first make sure the person is responsive or unresponsive.
Unresponsive.
Perfect. What would you like?
Yeah.
Blue is okay. You want black or gray?
That's gonna be popular for you.
Yeah. Y'all like this little game? It's something I made to go fun to make people interact when I be out. Because CPR can be boring. 735. Oh, she said, "Oh Lord, that's me."
She don't know it.
She don't know it. What would you like? Want a badge reel or a badge reel?
Good one.
Don't say no. 724.
Who was it?
You want me to spin it for you? Okay. Okay. Where are the 2 steps and hands on the CPR?
Chest compression. You said 2 steps? Well, first you're gonna assess the patient. Then you give the compression.
You got another step. What's another step you do?
So then you well, call 911.
Yes, call 911. Hey, trust me, you do not want to be stuck on the compressions and nobody come to rescue you. What would you like? I have plenty. I have a badge reel, a coaster, magnet, or hand sanitizer. What color?
A pink or green.
They don't have in that color.
She's starting to.
See, y'all got me cutting up in the church. I was in the CPR, now
Quentin just picked one.
What color? What color? What color?
We got a car coaster magnet badge reel or hand sanitizer.
Just
Coaster's fine, but he can pick a color.
What colors?
Coaster black, blue, and gray.
Blue. Actually the color.
Baby, no, she did. Look, I gotta take a minute. I'm still processing.
Next time you look,
She tried it. She tried it.
You're all right.
She tried it. I had to come up out of CPR here and go.
That's my mother-in-law.
Really?
Yeah, she be trying it all.
All the time. She ain't even know. All right, last one. 732.
That's me.
That's you. Would you like for me to spin it for you?
Yes, ma'am.
Okay. What does CPR stand for?
Cardiopulmonary resuscitation.
Perfect. What would you like? A badge. Okay. Thank y'all so much.
Thank you.